In this video, we are going to discuss about acute suppurative otitis media, that is ASOM. What is the definition of acute suppurative otitis media? Just like the name itself suggests, it is acute in onset, it is suppurative, that is pus forming, and it is an infection of or inflammation of middle ear, that is otitis media. Okay, it is an acute inflammation of the mucoperiosteal lining of the middle ear cleft characterized by pus formation. It is mostly seen in infants and children. It is acute pus forming and affecting or inflammation of middle ear cleft. Everything is in the name itself. Okay. What is the etiology? Why does this happen? What is the cause for this acute suppurative otitis media? There are certain predisposing factors which will increase the risk of developing ASOM. What are those predisposing factors? It can be eustachian tube dysfunction, which is commonly seen in children. Other than that, upper respiratory tract infections like common cold and sinusitis, these predispose for developing ASOM. Other than that, adenoid hypertrophy, allergic rhinitis, barotrauma, cleft palate, all these conditions. These all will in turn, one way or the other way, will lead to blockage of the eustachian tube, which is a connection between the middle ear and the nasopharynx. So whenever there is blockage in this eustachian tube because of eustachian tube dysfunction or because of some upper respiratory tract infection, like common cold can lead to blockage of the nasopharynx, or sinusitis may lead to inflammation of the nasopharynx leading to congestion and in turn leading to blockage of the eustachian tube. Adenoid hypertrophy, adenoids become enlarged and block the eustachian tube. Allergic rhinitis because of congestion again. Barotrauma because of some pressure, there will be tympanic retraction, so and so, leading to tubal occlusion or cleft palate. So all these in one or the other way will lead to blockage of the eustachian tube, which will in turn increase the risk of developing ASOM. So this is a image showing ASOM. Also, bottle feeding in supine position may increase the risk of aspiration, which will in turn lead to predisposing factor, which will also serve as a predisposing factor for developing ASOM. This is how the connection is. This is the eustachian tube, here is the nasopharynx, and this is middle ear. Any infection from the nasopharynx may ascend up and in turn lead to ASOM, that is infection of the middle ear or inflammation of the middle ear. What are the causative organisms that lead to formation of or that lead to ASOM? The main causative organisms are Streptococcus pneumoniae, H. influenzae, Moraxella catarrhalis, and Streptococcus pyogenes. There are stages of ASOM. Like all of a sudden ASOM doesn't develop, it develops in stages. Though just like I have discussed before, first stage will be stage of tubal occlusion, that is eustachian tube will get blocked due to many reasons which we discussed before. So what will be the symptoms in this stage of tubal occlusion? The patient will start developing pain in the ear, mild deafness, and the tympanic membrane, if visualized, will be retracted. So this is a stage of tubal occlusion. So what happens once this tube is occluded? So as we all know, this is EAC. I am writing middle ear as a box. Okay. Through this box is a connection, that is a eustachian tube that will lead to nasopharynx. So now there is a blockage in this eustachian tube. So what happens? Now the tympanic membrane here the pressure will be negative. So tympanic membrane will be retracted. So this is a stage of tubal occlusion. Here the patient will develop earache, mild deafness, and a retracted tympanic membrane. After this, there will be, this will serve, due to negative pressure, this will serve as a site of potent infection or niche for infection. So for this reason there will be a stage of pre-suppuration before pus formation. So still now there is inflammation going on. So there will be throbbing pain and fever can happen, congestion of the tympanic membrane, and middle ear effusion, that is accumulation of fluid in the middle ear will take place, that is called as middle ear effusion. So once the tube is blocked, there will be active inflammation going on because of that reason, or you can say infection is going on over there. Some bacteria have come and because of that negative pressure they are growing over there and that is leading to fever and increased blood supply for the tympanic membrane, that is congestion of the tympanic membrane, and it will produce a serous type of discharge which will lead to middle ear effusion. After this, there will be pus formation, that is called as stage of suppuration. This is the third stage. Whatever the serous discharge is there or whatever the effusion was there, that will start developing into a pus leading to bulging tympanic membrane. So now the fluid has got accumulated here and this is pushing the tympanic membrane outwards. So now whatever the tympanic membrane which was retracted, that will be bulging outside. So bulging tympanic membrane will be there. There will be severe otalgia, severe pain, and possible spontaneous rupture of the tympanic membrane can also be seen. So this was stage of suppuration. Then coming to stage of resolution, gradually, eventually, our body will try to heal. So discharge will subside and healing of the tympanic membrane will occur. If untreated, it can lead to a stage of complication. That is, it can lead to inflammation of the mastoid, that is mastoiditis. Facial nerve palsy can happen. Then intracranial complications can happen, like a pyogenic abscess or dural abscess, or it can lead to meningitis also. So all these are stage of complication. So what are the four stages? Stage of tubal occlusion, followed by stage of presuppuration, followed by stage of suppuration, and then stage of resolution, and if untreated, it can lead to stage of complication. What are the clinical features? How does the patient present to us? Just like we discussed in all these stages, it depends on the stage with which the patient will present. Okay, overall it will be otalgia, that is ear pain. Fever might be there because it is a suppurative condition. Pus forming will be there, that means an infection is going on. So fever is a systemic symptom. Other than that, hearing loss can happen, conductive loss, because fluid is getting accumulated in the middle ear and fluid will hamper conduction. So sound cannot pass from air to the fluid. That is, middle ear had to do that job of increasing the amplitude of the sound so that it can travel into the inner ear where there is fluid. But because now the fluid is getting accumulated in the middle ear itself, there will be conductive type of hearing loss. Other than that, there can be otorrhea if the tympanic membrane ruptures. Whatever the fluid that was getting accumulated in the middle ear, that will come out through external auditory canal because of the ruptured tympanic membrane, and hence we can see those secretions outside, and that is called as otorrhea. What will be the signs of ASOM? If we look at the stage of congestion or that is tubal occlusion or presuppuration, what is happening inside the middle ear? There is active infection going on, because of which there will be increased congestion of the tympanic membrane. So when we visualize this tympanic membrane from the external auditory canal, this will appear as if it is red cartwheel shaped. So because of this, it is called as congested or bulging tympanic membrane. And as we all know, in the stage of tubal occlusion, there will be retraction of the tympanic membrane. But as the fluid gets accumulated here and the secretions will pile up, that will lead to a bulging tympanic membrane. So tympanic membrane will start bulging outwards. So these are the signs which we can see on otoscopic or otoscopy or examination of the ear. There will be congested and bulging tympanic membrane. There will be loss of light reflex, that is, we will be able to see a cone of light in the antero-inferior part of the tympanic membrane, but that will be lost. And tympanic membrane perforation can be seen in severe cases with purulent discharge coming out. These are the signs. How do we come to the diagnosis of ASOM? What are the investigations we'll do? Just like I said, otoscopy. On otoscopy, if we are able to see a congested, bulging or a perforated tympanic membrane, then it will lead to a diagnosis of ASOM. On tuning fork tests, we will be able to see a conductive type of hearing loss in Rinnes and Weber's test. So if they point towards a conductive type of hearing loss, then it is probably ASOM. Other than that, we can do audiometry in older children and adults, or we can take the culture of the pus which is draining out and send it to culture and sensitivity, and based on that we can select appropriate antibiotic. So these are the investigations which we'll do. Otoscopy is a major one. Clinically only we can diagnose. Other than that, we can do following tests. How do we treat this condition? What are the treatment options available? It is treatable by both medical and surgical methods. Medically, since it is a bacterial infection like streptococcal pneumonia, H influenza, just like we discussed before, so antibiotics are the preferred line of management. Amoxicillin or amoxiclav, that is amoxicillin clavulinate, are usually prescribed for about 7 to 10 days, and this, once the infection gets treated, eventually there will be reduced secretions. Also, there is severe otalgia, ear pain, and also because of that reason, we will prescribe analgesics and antipyretics for fever, that is paracetamol and ibuprofen. Other than that, we can also prescribe nasal decongestants. If the eustachian tube blockage is due to some adenoids or due to rhinitis, then nasal decongestants will relieve that congestion, and hence it will relieve the tubal blockage also. For that reason, we can give nasal congestions. Other than that, steam inhalation, same mechanism. Surgically, we will manage the case if needed. So what is the surgical procedure we will do? It is called as myringotomy. That is putting an incision over the tympanic membrane to drain the pus. Just like I told you before, there will be accumulation of secretion in the middle ear, and once these secretions start piling up, it will start pushing the tympanic membrane, and tympanic membrane becomes bulging, and eventually there will be rupture of this tympanic membrane and there will be otorrhea. Instead of letting all this happen, what we will do surgically is we ourselves will put an incision, that is a planned incision over the tympanic membrane, so that whatever the secretion was getting accumulated over here, that will drain on its own. Okay, so this is the procedure called as myringotomy. Otomy means creating an opening. Other than that, what we can do, we can create this incision, like if this is a tympanic membrane, we will put an incision and we will drain all the pus whichever was getting accumulated in the middle ear. After draining this, we can insert an instrument or a device called as grommet. This will keep the eustachian tube open, or it will keep the connection between middle ear and inner ear open. Okay, or basically this will keep the opening between the external auditory canal and middle ear open. Okay, so once we rupture this tympanic membrane, we will insert this here. That is called as grommet insertion. This will be done for recurrent or chronic otitis media. What are the complications? What happens if we don't treat this condition of ASOM? If ASOM is left untreated, it will lead to CSOM, that is chronic suppurative otitis media. So also, other than that, it can cause acute mastoiditis, just like we discussed. Facial nerve palsy can happen, petrositis can happen, labyrinthitis. Basically, it is like, if you know the anatomy of the middle ear, it is easy. So middle ear, this way is the external auditory canal, this way is the inner ear, right? In inner ear there is labyrinth, and on the roof this is cranial fossas, cranium, and below this will be eustachian tube and this will be opening to nasopharynx. So the infection from here can spread in any direction, and that will lead to the complications. If it spread to the mastoid, then it will cause mastoiditis. It will if it spreads to inner ear, it will cause labyrinthitis. If it spreads to the roof, then it will cause meningitis or intracranial abscess. So this way we can easily remember the complications of ASOM. How do we prevent this condition? Avoid bottle feeding in supine position, because as we discussed, this is a predisposing factor and it can lead to aspiration pneumonia like conditions, which in turn will lead to ASOM. Other than that, upper respiratory tract infection, basically what all those predisposing factors we discussed, preventing that will prevent ASOM. Other than that, since we discussed most common organism causing this was a streptococcus pneumonia, pneumococcal vaccine might help. And other than that, avoiding exposure to tobacco smoke might help in preventing ASOM in adults. In conclusion, ASOM is a middle ear infection usually seen in case of children. Early diagnosis and treatment might prevent serious complications. Good eustachian tube function and managing the predisposing factors are the key for prevention. So this was all about acute suppurative otitis media.